Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Next, we look at again we are continuing the drugs for the dyslipidemia, and this is going to be the part 2. So in the first part, we have seen the FMGE reductase, the cholesterol absorption inhibitors, the fibrates and the bile acid sequestrants. So to continue with, we are looking at the niacin. So niacin, the mechanism of action is it inhibits the lipolysis in the adipose tissue. So inhibits the lipolysis in the adipose tissue. It reduces the hepatic VLDL into the circulation. So reduces the hepatic VLDL. Yes, it reduces the hepatic VLDL into the circulation. So what are the site of action? The site of action is going to be nothing but the liver. So what about the side effects and the indications? The side effects of niacin is that it can lead to the facial flushing, the nausea, as well as the paresthesia, the pruritus, the LFTs, increase if the LFTs, the hyperuricemia, the insulin resistance, as well as the hyperglycemia. Next is what are the indications? Indications of niacin is nothing but the elevated LDL-C as well as the elevated TG. Then moving on to the MDP inhibitors. MDP inhibitors, it includes a lomitapide. The lomitapide, the mechanism of action is that it is a microsomal triglyceride transfer. So microsomal triglyceride transfer, the protein inhibitors, the decrease in the VLD production. So all this is the action. So there is a microsomal triglyceride transfer, protein inhibitors, decrease VLDL production. So next, moving on to the adverse effects. The adverse effects is it can lead to nausea as well as diarrhea and the increased hepatic fat. So what are the indications of the MDP inhibitors? That is lomitapide. So the indications is there is a HoFH, there is a homozygous familial hypercholesterolemia. Then moving on to the APO8 inhibitors. The APO8 inhibitors, it is nothing but the MIPOMs, Mersen. So what are the findings here? It is the mechanism is going to be decreased VLDL production. That is the mechanism. And what about the adverse effects? Adverse effects is nothing but the injection site reactions. Next, the flu-like symptoms as well as increased hepatic fat. So what about the indications? It is used in case of the HoFH, that is homozygous familial hypercholesterolemia. Lastly, we move on to the PCSK inhibitors. PCSK inhibitors, it includes evolocumab as well as the alirocumab. So what are the actions? It is mechanism being the protein convertase. The mechanism is protein convertase. Subtilism. Next is the Kexin type 9 inhibitors, that is inactivation of LDL. Inactivation of the LDL. Receptor degradation, that is increased removal of LDL from the bloodstream. Increased removal of the LDL from where? From the bloodstream. Next, we move on to the adverse effects and the uses. So adverse effects, it includes the myalgia, delirium, as well as dementia. The uses is it can include the heterozygous. So heterozygous familial hypercholesterolemia. To learn and grow daily like this, please do subscribe.